Okay, welcome to Dr. Mark Carriage's YouTube series on group work. And this is a professional, this is meant for professionals. So therapeutic babble is used. And as I'm pulling up the PowerPoint, hopefully you can see the PowerPoint. So it's not meant for the general audience to understand all the psychobabble stuff that's used in the field. Um, it's for people, professionals in the mental health field. And again, I have a YouTube channel, Progressive Therapy, and my name is Dr. Mark Carriage. Okay, so some history. I've been doing groups for a long time, since '84. Um, I would consider doing my being involved in as a co-therapist in my group in a group at Texas Tech. At any rate, uh, I received educationally. I received my bachelor's degree in '79 from SIU Edwardsville, master's in '81 in counseling. '85, I received my PhD in counseling from St. Louis University, both master's and PhD, St. Louis University in St. Louis. I did do an internship in counseling psychology at Texas Tech University, which is one of the best experiences professionally I've had. Oh, I gotta admit that when I did go do training in Taiwan, that was pretty fun too. At any rate, you can call me Dr. Mark, Dr. C, whatever. I've been in the prison system for 40 years. Kind of recently just did it. And you realize when you're getting too old, like some politicians should realize when they're getting too old for the game, it's time to step out of the game and sit on the bench. And I consider this sitting on the bench. The prison system is rough and tumble, and but I've been involved in that corrections for 40 years, some form or fashion. Retiring from the state of Illinois in 2012, with 27 years and years later. But in between that, I was involved in SVP program and a year and a half or two with Lutheran doing reentry stuff, then back to the prison system for. Okay, so currently working in private practice with our Far Chad Welch in Metro East Counseling. It's in the Metro East. Well, that rhymes, doesn't it? I guess no puns intended there, but Metro East of St. Louis, St. Louis, Missouri. We have a number of practitioners on board. I also consult with TCI part time as we're developing a youth program. And Matt Adams has helped me try to do this YouTube stuff. I'm still really rusty on it, but I'm getting there. I'm a work in progress. He's not present for this video taping. I could be reached at mcarich@aol.com. So if you want the PowerPoint, you want handouts and stuff, email me at mcarich@aol.com. I will send you them on any of my video series. So what are we doing today? Well, I'm talking to you for one. But we're talking about the nature of groups because the nature of groups consist of dynamics. And I have to point out, you have to have more than two people involved in a group or it's something else. and non-related. Because if you're all related, it's a family systems therapeutic endeavor. So today we're going to talk about issues in group, and there's a ton of them. I'm just going to throw out a list of them and maybe highlight issues within the issues. How about that? No puns intended, or maybe puns intended. I do have a dry sense of humor, so if at one point I'm going to have to tell you when to laugh. Okay, issues. And this is a short video designed that way because try to capture the people's attention span. But on issues, chit chat versus addressing issues. Now, you can chit chat throughout the entire group and it becomes a bullshit group because that's what you're doing. Or you can chit chat. I like to do a little chit chat to warm the group up, then move on to issues, address the issues. Jay Haley uh, emphasized little chit chat, warm up stuff in his therapeutic approach. And he studied with several of the greats. At any rate, chit chat's okay, but moving addressing issues. Anger and hostility usually pops up a lot. People are frustrated with something in their lives, or they could be frustrated or angry at what somebody else said. They could be hostile anyway. Depends on what you're doing. If you're doing an anger group, people are going to come in usually pissed off because they're hostile. But anyway, if you're not doing an anger management type group, people still can express those types of feelings, and it's important for you, one, to not take it personally, two, to diffuse them, and then that could become the issue that they're working on. Defensiveness. Freud's defense mechanisms um, emerge in groups at different points in time, but some members can become defensive. And again, it's up to you as a leader to deal with it. Okay, resistance. I don't even like that word anymore. I use reluctance. I don't even know what resistance is anymore. But technically, they're described as barriers that emerge within the group process that prevent movement forward or accomplishing goals. I like the word reluctant because resistance seems like it's more solidified, more concrete. Reluctance is you have the reluctant client that's a little bit reluctant to change or move forward. The self disclosure thing, I'm sick and tired of talking about self disclosure because I've been in groups where leaders self disclose everything from A to Z. Now, 50 years ago, that was the thing to do. That's what you were taught. Self disclose everything, including what the dog and cats are doing and how they're getting along. Um, just like some of the old family systems therapy, bring everybody, including great grandma and the rocking chair, for the family session. But self disclosure is for the group members to self disclose what their issues are, not what your issues are. So it's okay if you're a therapist and you throw out something from your life, makes you human. But don't, one, well, a couple of things. If you're working with antisociality, you got to be kind of okay with whatever you throw out. And once it's out there, it's out there. Like it's not like you can reel it back in. Power struggles. I've seen that a lot. In the old days when I was an idiot, I had to win the power struggle, especially when you're working with folks that have power issues, as in serial rape issues, serial killing issues. Um, and so I thought it was important to win. It's important that you maintain control of the group. So how do you do that matters.